All right, guys, it is Sunday night, and that means it is Sunday night service. And I am so excited tonight. I thought last week was really entertaining. I have a feeling today is going to be something. So I've got Dr. Joe Pazona on here. I am so excited about this. He's a urologist, and we're going to talk men's health tonight. But while you guys are logging on, and getting set up and all of this, and getting your guys in front of the computer tonight or the phone tonight from and all those things, and put your questions in the comments, and we will address those tonight. But here's the thing. I have a lot of male patients who are refusing to get a vasectomy. I see a lot of female patients, mainly female, 75-80% female, and the husbands refuse to get a vasectomy. And I have a whole lot to say about that. So tonight we're going to talk about this, and we're going to talk about what Dr. Joe Pazona does. But we're going to talk about no needle, no scalpel vasectomies, erectile dysfunction, bladder health, men's hormones. We're not going to talk about women's hormones tonight because I'm going to dedicate this whole 30-45 minutes to men tonight. But first, while I'm waiting for you guys to get logged on, I'm going to tell you a little bit about Dr. Pazona. Actually, they call him Dr. Joe, which I think is it Pazona? Pazona?
Yep, that's right, Danny.
I'm a redneck from Kentucky. I don't know. I can hardly speak English, but his patients call him Dr. Joe, but he's a board certified urologist, and he's been practicing over 10 years, just like me, except he's a lot younger than me, clearly. He specializes in minimally invasive surgical techniques so that you can recover fast and get back to the life that you need to be living, right? He also treats urinary incontinence with the groundbreaking axonics therapy. I can't wait to hear about this. Is that for men and women?
Yeah, definitely.
Okay. All right. And the UroLift, not a clue what that is, for enlarged prostates, but it sounds promising over there. He also conducts his no needle, no scalpel vasectomy procedures, which I can tell you right now, my patients swear by. So this is a good one right here. If you're in need of surgical options or preventative education, long-term health solutions, let me tell you, this guy is the guy to go to. And if you don't follow him on Instagram, he's hilarious. And he just did a post this week about apple cider vinegar and penis enlargement, where I literally spit my water out when I was like, what in the heck is he talking about? We're going to talk a little bit about it tonight. So anyway, guys, I am so excited tonight. Welcome, Dr. Joe, and let's take it away. What are we going to talk about tonight? I'm so happy to have you here.
Danny, thank you so much. I'm truly humbled by your kind words, and I'm a big fan of yours as well. I love what you do, putting yourself out there and promoting wellness above everything. We've got too much sick care in this country, and it's about time someone's speaking well care. And so I just love your venue, and I'm just so excited to hopefully be of service to your listeners tonight.
Well, thank you. And back at you. You're doing the same thing. I mean, you're out there teaching, and it's not always all about medicine, right? I mean, you're talking lifestyle, eating well, sleeping well, moving well, all the things. So right back at you. I appreciate you so much. All right, guys, let's just get right started into vasectomies. Tell us about what you do. Tell us about a no scalpel, no needle, nitric oxide laughing gas vasectomy.
I mean, could it be any easier, Danny?
No,
I mean,
no.
at the end of this session, if a guy has a hesitation, please come and talk to me, because I'll be honest, patients are upset when I'm done with the procedure. They're literally like, can you keep going? Can you find something else to do? Because this laughing gas is awesome. What we do is we have guys come in. We do same-day consultations. I had a patient travel 7 hours to come see me the other day.
Wow.
And we do our consultation the day of. And we then get you hooked up to some laughing gas. What's nice about this is it's a patient-driven experience. So unlike the dentist where they might put that nasal cannula or mask on and just force you to take in whatever they give you, you
Yes.
control. So it's a choose your own adventure, as I like to say. So guys can get as loopy and as high as they like. And as long as they don't try and help me with the procedure, we just let them keep going. And I have guys who honestly are sleeping the whole time, and other guys, it's like, Friday night at Zany's. It's pretty fun. And I'll tell you, you think you're pretty funny when the audience is all on laughing gas. I've got some good jokes, and they seem to go over well.
Oh my
But
gosh. Okay.
so it's yeah. So once guys are chill, Danny, then it's I've got a device, and for people interested, you can go to my webpage, just PazonaMD.com, and I'm sure Danny will put some links in as well.
I'm doing it right
And
now.
you can watch the whole video. I had a guy film his vasectomy. He was not on laughing gas, and it was under 10 minutes. And so I have a little device that injects local anesthesia without a needle. It shoots aerosolized lidocaine, so it doesn't hurt as bad. Plus, you don't get the needle poke. And then through just a tiny little skin poke, a couple millimeters without a scalpel, I can do both tubes through that tiny little incision, usually 10 minutes or less. And guys are home with their favorite beverage, Netflix show, and an ice pack before they know it.
Wow. Is there any downtime? Like when my ex-husband got a vasectomy, I packed him up with ice and all that for like 24 hours, put him in the chair, all that. And there was a little bit of downtime. What's the downtime?
So I tell guys 3 days of couch, beverage, TV show, book, anything they like doing that's non-physical. Now they can go out to dinner with their partner. They can go take their kids to the park. Just as long as they're not lifting anything more than 10 pounds for at least 72 hours, they're okay to get up and walk around. If they can avoid any real heavy exercise, sexual activity for a full 7 days, then the recovery is just completely smooth sailing. I do have some guys who feel so good day 4 and 5, they might hit the gym or get a little frisky. And some of them go, ooh, that was a little bit too soon. I'm going to tell my buddy to take it easy for the full 7 days. But certainly I realize people are busy and they got to get back to work. And most guys have it done on a Friday. And by Monday, they're back at it.
Speaking of getting frisky, actually, so how long does it take? Like, what do you do on a traditional vasectomy? How long is it before they say that you can have sex without, well, would you be sterile? No.
Yeah.
Is that how long does it take? Or is it immediate?
Yeah, that's a great question, Danny. So it is definitely not immediate. So I warn people that they've got to complete the homework assignment I'm going to give them before they can get frisky without other forms of contraception. So the two numbers I like following are 20 ejaculations over a 2-month period after the vasectomy. And both of those are important. Obviously, the frequency of ejaculations matters because if you don't flush the pipes, the swimmers are still going to be there.
Yes.
Now, the reason you also have to wait 2 months is because the vas deferens, the tube we're working on, which is coming from the testicle, it wraps all the way through the groin area, down into the pelvis, back behind the prostate. So there's a long journey for the swimmers to jump in the swimming pool. And so I occasionally get the overachiever who does 20 ejaculations in 20 days. And he goes, all right, doc, I'm good. Not yet. It takes several months for all the sperm to get to the pool. So you could do 100 ejaculations in 20 days and all the sperm still haven't gotten there. So that's why the passage of time and number of ejaculations is important. Now, even then, we don't make any assumptions. We have all of our patients do an at-home sperm check. So it's super convenient. You don't need to come back and see me in the office. You don't need to go into some lab with your specimen cup. You just do your business from home and you mail it into a lab. And then we'll call all our patients with the results. So I warn them, until you get that phone call from us, please use protection.
Oh, at home. I had no idea. I've completely, okay, well, that makes it much easier because you always hear the stories of the people who never go back. Yep. And then they've got a baby, they've got a 17-year-old, an 18-year-old, and a 15-year-old, and
Yeah.
and they've got a newborn baby, right?
Oh, all the time. And they simply just didn't do the test. And it's sad about half the guys don't do it, despite all of this education. So this is a great opportunity for the women to once again take charge, as y'all usually do in healthcare, and say, listen, honey, you ain't getting any until we get that sample back and we know you're shooting blanks.
That's
So
exactly right.
I mean, just, maybe I'll help you get there. I'll help you with the 20, but we ain't going without protection until you bring in that sample. And again, we make it so easy by just mailing it in.
Yeah, that's easy. Yeah, I tell my women patients all the time, on the husbands who decline a vasectomy, right? Because there's a lot of myths around vasectomy as well, like prostate cancer, right? Increasing your risk, right? I mean, you know about this. Actually, we talked about this at one point.
Yeah, I mean, it's not true at all. There are zero long-term health risks to a vasectomy. Zero. Now, here are the benefits. Number one, better sex. You want to turn on your partner, guys, go take charge of contraception after she's been doing it all these years. And you will see a woman who is a happy woman. Nothing will turn her on more. And studies have shown this. Studies have shown that sex with couples is better after a vasectomy. Number two, there is no association whatsoever between prostate cancer and a vasectomy. The only link at all is the fact that to get diagnosed with prostate cancer, you have to be a man who's proactive about your health. Because if you don't go get a blood test and a finger exam and get checked in your 50s or 60s, we won't diagnose it. So which guys are most likely to do that? Well, the same guy who 20 years earlier got a vasectomy, because he already knows what a urologist is and he clearly is okay taking charge. A couple other big myths are that this causes low testosterone.
Oh, where'd he go? He'll be back in a minute. I think what he's getting ready to say is that another myth is that it causes low testosterone, and it does not. And he'll be back in just a second. You guys hit your heart buttons, hit your like buttons, and give us your questions up here. All right, there we go.
There.
Oh my gosh. So you went out on another myth is that it's going to cause low and that's what.
There we go. See, my phone was upset over this myth. So
yeah, right. It said we're not talking about this. Okay, no low testosterone from a
zero. When a man's testicles produce testosterone, they are released directly into the bloodstream. So it does not require the vas deferens to get out. And lastly, this is not going to affect erections. Erections have a completely different physiology. And again, guys, all we're doing is keeping the swimmers from jumping in the swimming pool. Even the ejaculation or the semen that comes out is going to be absolutely not different at all.
Fantastic. And I tell patients every week, you're going to get more sex. I had no idea there were studies behind that.
Oh, yeah.
And I tell the women, oh my gosh, when you can't get pregnant, then a woman's mind, because so much mind plays such a big role in libido with women, right? And if she thinks she can get pregnant,
no doubt.
well, she's not having sex. You're not coming near her. I had no clue that there were. So now I know that there were studies about that.
Yeah.
But it's a fact. Well, you mentioned erectile dysfunction. It won't cause erectile dysfunction. I want to talk a little bit about that, because I am seeing younger and younger and younger men with erectile dysfunction. In fact, I sent someone to you recently who is really young, and testosterone levels were decent, not great. Let's talk a little about that. Why do you think, well, you probably know, why are men having lower testosterone levels? In fact, I know that we have way lower testosterone level than our grandfathers and our fathers from the 60s and the 50s. Less hand strength, all kinds of things men do. Why are we seeing that? And why are we seeing more erectile dysfunction? Does low T and erectile dysfunction go hand in hand? Because I have several male patients who've got really pretty low testosterone, but they don't have any problems with erectile dysfunction, they say.
Yeah, it's definitely, if you think about it, there's two buckets, and they do overlap to a degree, right? There's no doubt that low T is a one of the predominant causes of erectile dysfunction in young men, but not every young man with ED has low testosterone. And as you just pointed out, there's plenty of men with terrible testosterone levels and they still somehow get erections. So it's very complex. And I think to answer your question, I think one of the primary reasons we're seeing this is we just don't take care of ourselves. Our forefathers got out and worked in the field. They ate whole, real foods. They moved their bodies. And after those long days, they got sleep. Now what do? We sit in front of a computer all day. We eat fast food, ready-made food. We're too tired for the gym. And then we're up all night staring at our phones and we don't get adequate sleep. All of those things contribute to low testosterone. And all those things can lead to atherosclerosis at a young age. I mean, I'm sure you're seeing it as well. There are a lot of young guys with type 2 diabetes, hypertension. And, you know, we used to think these were diseases of people, oh, when you're in your 50s and 60s. No, I mean, I've got 30-year-old patients on 3 different antihypertensives, metformin. I mean, it's incredible. So there's no doubt true organic causes of ED and low testosterone, and they definitely cross over and go hand in hand.
Let me tell you something. I have a real hard time with all of these low T centers out there. I get patients in, and I have zero problem with testosterone for men, and if it's monitored well. And it's not like a bunch of cattle going through boom, boom, boom. I mean, I have had patients, you know, I have an endocrinologist that I'm really good friends with. And he told me years ago when I was using testosterone, I actually don't use testosterone on men anymore because I send them to people like you, but who can manage them better. But he said, you know, Danny, you have got to be real careful with their hemoglobin and their hematocrit, you know, anytime, you know, you don't want to thicken their blood and things. And anyway, the low T centers that I see, oftentimes they just give them testosterone, just a shot of testosterone or what have you. And they're not following up on eating well and sleeping well and moving well and getting to the root cause of all this. So yeah, I agree with you. And a lot of endocrine disruptors out there, you know, all of our plastics and all the things. It's really something, and it's disheartening for young males. Really disheartening. I mean, it is.
Yeah, you're definitely right there, Danny. And you know, to comment on a couple things you said. Listen, I'm not going to disparage any other healthcare providers or places. And I'll be honest. One of the reasons that low T centers are flourishing is that most of our colleagues really don't learn hormones, and they really are doing a disservice to their patients. Because if we look at testosterone levels in men, you know, a normal range by the lab is a total T level between 250 and 827 on my lab panel. I'll tell you, a guy sitting at 250 sure feels a whole heck of a lot worse than a guy sitting at 800. But both people will go to their primary care provider and be told, you're fine, don't worry about it. But that guy feels sluggish. He's noticed a decrease in his libido. He's noticed that every year 5 more pounds come on, and he is getting engaged with his health and having trouble. And there's no doubt there's a difference between low testosterone and optimal testosterone. And that's, again, that goes back to where we started our conversation, the difference between sick care and well care. If you're below 250, you're sick, your levels are abnormal, here's some testosterone, great. If you're anything above that, too many of our colleagues are not addressing it, even though they are suboptimal. But you're 100% right. This can't be a strip mall cookie cutter approach. It has to be attacking this from what I think are 3 different pillars. I've got your TRT or testosterone replacement therapy in one pillar. I think a deep dive into nutraceuticals, supplements, and ways to augment the effects of hormones. And then the biggest bucket is self-care, diet, exercise, sleep, and mindfulness. What are you putting in your body? Are you moving your body? Are you getting 8 hours of sleep a night? And are you practicing stress relief? Because I tell guys, if you don't do those things, there is no amount of testosterone that's going to cause you to all of a sudden not be a jerk or lose that tie around your waist if you're going to be stuffing it with chalupas. So you've got to address all of them. And I think it is, I agree, just throwing testosterone at the problem is irresponsible.
Irresponsible.
But it's also irresponsible to not acknowledge that these men are suffering and going through things and need the guidance of an expert.
You bet, which is why when I was checking your website out this week, actually, I mean, you've got it, guys. He's got a great website. And talking about nutraceuticals, he has a fabulous supplement store on there addressing things like cardiovascular health and hormone health and too much estrogen, not enough testosterone. I mean, I'm telling you now, yes. And so to have a physician who actually, or a nurse practitioner, I mean, but he happens to be a physician who addresses the whole body is very, very important. I'm just telling you. And I'm all about getting your hormones optimal, not supra physiological. And I think that's real important. And talking about, I have a lot of patients who think that testosterone causes prostate cancer. Okay. Yes, that's what. And then, so let's talk a tiny bit about that. And then also prostate cancer and you know, what happens when your prostate's removed, things like that. But testosterone and prostate cancer, I tell patients, I don't know any research that says it causes prostate cancer. I think it can wake up something in there possibly, but you tell us, you're the expert.
Yeah, well, I don't know if I'm an expert in that, you know, even amongst urologists, there's a lot of controversy here. And there are leaders in the field who say, you know what? We've got zero data, give testosterone to everybody, I don't care. Then I have other guys who are very anti-testosterone and follow that strict, only if you're under 250, and even then, if you've had prostate cancer, don't do it, and everywhere else in between. There's no definitive data to suggest that testosterone replacement therapy, when done in a responsible fashion, speeds up, unleashes, causes, brings out, whatever terms you want to use, prostate cancer. For better or for worse, when a man has prostate cancer, he's probably had it for 5 to 6 years, even before diagnosis. And frankly, if you look at autopsy studies, 80-90% of men have some prostate cancer sitting in their prostate. So I've got guys who I've treated for prostate cancer, and I have them on testosterone replacement therapy. And I have zero hesitation about that. Now, certainly if a man is actively being treated, has a very aggressive form, that's a different story. But there's really zero data that it's going to cause it. And, you know, I think that along with the heart disease myth are the probably two biggest reasons why men or their spouses might be concerned about testosterone replacement therapy. But there's, again, even the American College of Cardiologists or Cardiology Association, I'm probably mixing that up, have come out and said definitively, we don't have any data saying that testosterone causes heart disease either. Certainly use caution in someone with history of heart disease, lots of risk factors, but again, there's no contraindication. So I think to put a bow on testosterone, Danny, just come and have a conversation. You know, that's why I do what we do, and can't harm to learn more. And I've got plenty of guys that I don't put on testosterone replacement therapy. We just focus on their diet, their sleep. We put them on a couple of key supplements, and they do better, and that's great. So
that's exactly right. So prostate cancer, I don't know, are numbers going up, or numbers going down, or numbers staying the same? What's the average age? And I don't know this for prostate. Do you know what?
Yeah, that's a great question, Danny.
I wonder, because we know 80 or 90% when they die, yes, they have some prostate cancer in there on autopsy. I wonder what the average age is for people to be diagnosed with it. It seems, I don't know that answer, but let's talk about erectile dysfunction after prostate cancer.
Sounds good.
What do you see?
Yeah, so I think to just quickly answer your question, you know, when prostate cancer gets diagnosed is really a matter of how aggressively patients are getting screened for prostate cancer. So it's important to realize that prostate cancer doesn't cause symptoms until it's way too late. Really advanced forms will cause bone pain, trouble urinating, but most men I diagnose with prostate cancer, they feel fine. And there's been a lot of controversy over the PSA blood test in recent years, Danny. So I've seen a shift in my career. Early on, we were diagnosing a lot of cancers and in younger and younger men because we were more aggressively screening. And now there's been a bit of a backlash against that, and fewer men are getting PSA. So I'm seeing more advanced cases and older men getting diagnosed. And so now we're kind of going back toward, well, maybe this blood test isn't so bad. So again, this is important where you have a healthcare professional that you trust, get the blood test, get a finger exam, talk about the pros and cons of screening. And then once we do diagnose it, Danny, yeah, we've got some big quality of life issues to consider because, the prostate itself has nothing to do with erections, but the nerves that go to the penis that lead to erections run right alongside the prostate. So any prostate cancer therapy, whether it's radiation or surgery to remove the prostate, can damage those nerves and leading to erectile dysfunction. So for a disease where a man feels fine, a disease in which even in advanced stages men can live with for many, many years, it can be a really tough decision to say, geez, do I really want to go through this aggressive of a treatment that's going to definitively impact my quality of life for an unclear health benefit? And so that's, again, where meeting with a urologist like myself, we can help walk through the nuances of that. But definitely erectile dysfunction is seen after any prostate cancer therapy.
Yes, it is. And it's usually a year to 3 years, I think we were talking about earlier. Is that what you said? So some men may take that long to get a prostate or to get an erection back.
Yeah, I mean, if we're talking purely a natural erection, then absolutely it can take a couple of years. Now, as we talked about before, we jumped on with our viewers. 50% of men by age 50 have erectile dysfunction.
Isn't that
So,
incredible? 50% of men by age 50 have erectile dysfunction.
Yeah, and no one and guys aren't talking about it, and they're feeling
they're
ashamed.
not.
And if you go every decade you go up, add 10%. So by age 70% of men. So it's hard to take that in the context of a prostate cancer treatment, because if baseline 50 to 70% of these men are already having difficulties, then yes, absolutely, they're going to have more difficulties after treatment. But I tell all men and their partners, listen, within about 6 weeks of getting your prostate removed, if you've got good urine and bladder control back, and the two of you want to be intimate, we have therapies to help you get erections sooner. Now, they may not sound great, things like needle injections and vacuum devices, but I have plenty of men and their partners who find physical intimacy after treatment. And I do have some guys who also been very fortunate and took good care of themselves, and they're getting natural erections back in 6 to 12 months. Not everybody, we don't make promises. But again, it's a very individualized decision. And, it's really important to include your partner on these discussions and talk about other ways of being intimate.
You bet. Louise Davis says, what about enlarged prostates? So, Louise, what about it? What are we asking here? I mean, how do we treat that? Now, that to me is an inflammation or an inflammatory response. It's enlarged. Who gets an enlarged prostate?
Yeah, so I think it's important to make sure we set our definitions before moving the discussion forward. So I think enlarged prostate tends to be the term we all use when we're describing men who have trouble urinating as they get older. We say, oh, it's because your prostate is big. Now, the dirty secret that us urologists know that we don't bother telling people about is that there's actually little to no correlation between symptoms and the actual size of the prostate. So I have men, Danny, who have giant prostates. I mean, literally grapefruit size, and they have no trouble urinating. And I have men who have prostates the size of a large walnut or a small plum, and they can't pee worth a crap. It's dribbling out, and it's because the prostate internally is pinching the flow. So I think when we're talking about enlarged prostates, we're really talking about what are the urine symptoms. Okay. And you mentioned earlier, the Urolift procedure we do, which is again, a minimally invasive therapy where under anesthesia, it takes me about 5 minutes. There's zero sexual side effects. We go in with a scope endoscopy inside the urethra, and we place these clips that pull open the prostate lobes. The prostate internally, it looks like two butt cheeks kissing, and that when they're kissing, it's harder to urinate. So we want to pull them open. And the beauty of this procedure is that it gets men off of medicine. Prostate medicines have been linked with erectile dysfunction, lack of ejaculation, even the most common prostate pill, Flomax or Tamsulosin, has recently been linked to dementia. And so to be able to offer a minimally invasive therapy with no side effects that can improve bladder health, get men urinating better with at most a 1 to 2 week recovery, that's really been a game changer for our patients. So what I'd love if after this there's either a man listening or a man in one of these women's lives who's sitting there at the toilet for 20 minutes or waking up 4 or 5 times a night to go to the bathroom, and he's just that stoic man who's just going to live with it. Please don't. Just come and get an evaluation, because A, something bad might be going on with your bladder or kidneys, and B, there's a pretty easy fix.
Wow. Actually, what Louise was saying is, what about enlarged prostate and testosterone replacement? Is there a contraindication for that, I suppose?
Yeah, certainly testosterone can theoretically cause prostate growth. What I'd say, Louise, is we're going to, that's the beauty of seeing me as a urologist rather than some other doctor who manages testosterone. I manage all these other issues, urinary issues, sexual issues. So under my watchful eye, if a man starts going, hey, Dr. P, I'm noticing it's getting a little bit harder to go to the bathroom, I might say, okay, maybe it's time to shift gears and either back off some of the testosterone or go, hey, maybe we got to do a deeper dive into your urine symptoms, and let's see if there's an obstruction, get it relieved so we can keep you on this testosterone replacement therapy that's working.
Okay, cool. Well, talking about bladder health while you were talking, I mean, how do we protect our men and women? Actually, because you do see women, correct?
I do, yes. I see both men and women, and we certainly focus on, quality of life issues. I joke that I'm the guy who helps people in the bedroom and the bathroom. So if there's issues in either, I'm your guy.
Absolutely. How do we support our bladder health? In women and men? Is it the same, or is there something different that we do? Because I know, as a 55-year-old woman who had 2 children naturally, things get lax there, sneezing, coughing, laughing. And I tend to laugh all the time. I don't sneeze very often, but I can't jump on a rebounder. And I know do men have the same thing happen to them when if they were jumping or whatever? Would they dribble out like women do, or no?
Typically not. I think you hit the nail on the head, Danny. Women have more of a lack of support issue. The pelvic floor in women after birth, going through hormonal changes, if you've put on weight, if you smoke, these are all things that weaken the pelvic floor. And so what you're describing is what we would call stress incontinence. When you stress the bladder with a cough, laugh, sneeze, or jump, urine squirts out. And there are certainly some non-operative therapies out there. This is where you're going to do a deep dive with a pelvic physical therapist to do Kegels. But I also offer a single incision, minimally invasive sling procedure. And I know that sling and mesh gets a terrible rap out there, and I understand why. But the mesh complication rate for these slings is 4 out of 1,000 women. So, nothing we do is 0 or 100% medicine. But if, 4 out of 1,000 women are going to have a complication for mesh, and the other 99 point how many percent are going to do well, it's a 10-minute procedure with like a weekend recovery. I've got women who have been suffering with bladder leakage for years. They're scared of the mesh because of all the lawsuits on TV and all the lawyer ads, and there's reason behind why those things are there. But this mesh specifically is very safe. and it's a pretty quick recovery and can fix all this.
Wow. What? I didn't know about that. So, okay, well, what is axonics? Is that something totally different? What is that? 'Cause I'm
Yeah,
learning.
so it's so we talked about stress incontinence. Now, the
Yes.
other sort of incontinence or leakage that women and men can suffer from is urge incontinence. You get that urge, and you better hit the bathroom, because if not, you're going. And in that scenario, basically the pathway between the bladder and the brain, something is off in the electrical signaling. The brain and the bladder are not communicating well, like an old married couple. And so when doing all of the other therapies like avoiding caffeine, having soft bowel movements every day, not trying to hold your bladder, and medicines don't work, the axonics therapy is basically it's a bladder pacemaker. And the beauty of this therapy is there's a trial surgery that I do in my office. It takes me less than 10 minutes. No cuts, no incisions. We put a tiny little needle in back where the sacrum is, and for the non-medical professionals, that's kind of right above your tailbone. It's the
Yes.
sort of the middle part of your hip, and we place a little electrode, and it gets connected to a temporary stimulator, and it's going to send these gentle electrical impulses to the bladder and get it rewired. And I'll tell you, Danny, when some of these women and men come back and see me a week later to have all the wires out, I mean, they're hugging me and crying, because these are people who've been suffering with 3, 4, 5 pad a day leakage. They can't go anywhere. They're up all night going to the bathroom, and they have this trial device put in, and they're like, I slept through the night. I could go out to lunch with my girlfriends again. I could go see my grandkids and not leak. And in those scenarios, we then put a permanent device through a tiny little incision in the back under anesthesia. And the axonics is so cool. It's a rechargeable device that works for 20 plus years. So a woman can have this implanted, and it's solved her bladder issues for more or less the rest of her life.
Wow. That's incredible. You know, it's such it's I'm dealing with this with my mom right now, who has
Mhm.
Alzheimer's, and she's so young. She's 76 years old,
Mhm.
100% incontinent.
Yeah.
And she knows it. She knows it. It's humiliating. It's embarrassing. You know, she's in assisted living, and we call them padded panties. Depends, padded panties. And so we put panties on over it 90% of the time if they'll do it for me. It makes her feel a
Mhm.
little bit better. But it's just so sad. I wish that I'd have
Yeah.
known about something like that earlier for her. You know. Wow. Okay. Lori Lanham says right here, the sling was the best thing. Look at that.
Yeah. Thank you,
It's
Lori, for sharing. And that is so important, women. Thank you for being candid and doing that, because it's one thing. Listen, I'm a middle-aged guy talking about this. I have no idea. I can't be in the shoes of what you women are dealing with as you go through age and childbirth, and you guys are the stoic ones of the family, taking care of everyone else, and you're suffering in silence. And so it's so important, women, if you've had some of these things done, please share your experiences. And listen, nothing I do is 100%, but we have phenomenal success stories with a lot of these therapies. And, it starts with a conversation. So thank
You
you,
bet
Lori,
it
for
does.
sharing.
It starts with a conversation. Lori also asked, is there a time frame for the sling? In other words, does it start not working after so many years? Well,
Yeah,
yeah,
that's a great question, Lori. So I think if you had leakage come back, there could be several reasons. So first and foremost, if you didn't take care of yourself, if you kept smoking or started smoking, if you didn't address any hormone imbalances, if you put on a lot of weight, those would all be risk factors for the sling, quote unquote, not working anymore. But more
oh,
often than not, women will develop symptoms of an overactive bladder, the frequency, the urgency, and the leakage associated with that. And women think, oh, my sling failed. but it has nothing to do with the sling. It's just now your bladder's overactive, and now you have a completely separate issue that we need to address.
Wow. Okay. Well, Lori, thank you. This sounds like she's a true believer in it right now. Yeah,
Awesome.
I can't imagine. I can't imagine. Okay, what else? We've talked about vasectomies, which is not a laser vasectomy. I got corrected on that. No scalpel, no needle, nitric oxide, laughing gas vasectomy. I mean, how incredible is that? I wish they did that for women. I had my tubes tied. My ex-husband, he got a vasectomy, and I had my tubes tied like within a matter of months. We double whammy made sure it was not going to be nobody was having any more children with anyone else. Actually, speaking of that, are vasectomies reversible? Say you got a vasectomy and then you fell in love and married somebody and they want children. Do people do that? Do they really?
Yeah. Yeah, most definitely. Now, obviously, I counsel men. If you're not sure, a vasectomy is not the right form of contraception. If you're with your current partner and you guys are still contemplating that next child, then take your time. But for the rest of men who have made their decision, we certainly know that life can throw us all curveballs. And there may be a scenario where you meet someone new and you now want to have kids. So a vasectomy reversal is definitely possible. You've got to go see a guy who's done special training in this. There's a lot of general urologists doing this, and they shouldn't. Go see a fellowship-trained infertility specialist, and they do a microsurgical reconnection of those tubes. It's pretty incredible work. It's a much bigger surgery than a vasectomy. No guarantees. It costs about $4,000 to $5,000 out of pocket. So obviously something that's not taken lightly, but if that situation arose, you could absolutely have it reversed.
Wow. Okay. All right. Vasectomies. We've talked about erectile dysfunction. We've talked about bladder health, touched a little bit on hormones. All right. What else? Anything else that we need to get? Anything you want to share?
Yeah. I mean, I think, Danny, the last thing we got to share is the apple cider vinegar.
Yes, guys, this is important. And I mean, you guys are going to want to go back and watch this. This is groundbreaking. You're only hearing it here tonight from Kentucky to Tennessee. Tell us about the apple cider vinegar and the penis enlargement.
So here's the deal, Danny. One of my passion projects is I've started a telemedicine company called Virtue Care. And we are about breaking down barriers and access to specialists, and we're a telemedicine company. And so we are just launching, and we're providing services in areas of need. And I've got a great marketing team, and would love for you guys to go check out our website. It's myvirtuecare.com. There's no E in Virtue Care in between the U and the C. And this reporter was looking for a credible source, if that's what you want to call the penis expert, for this growing trend online. Apparently, on a bunch of porn sites, they are telling guys to, I can't believe I'm saying this, put their penises in apple cider vinegar because it will make it bigger.
Dip your penis.
Now, I don't think I need to state the obvious that this does not work. And first of all, if it did, talk about the priciest commodity in the world, it'd be apple cider vinegar.
You bet.
It'd be about $1,000.
Bragg's Organic would have that listed on theirs. Bragg's is like the big one out there, right?
Yeah, exactly. Forget Amazon and Google. It would be Bragg's apple cider vinegar as
to the top of the stocks.
Exactly. So, and needless to say, it could be dangerous, but
I can't imagine dipping. Well, I don't have a penis, but dipping my penis in. I mean, I've been told you've got some big balls, Danny, but I do not have a penis. I can tell you that. Dipping my penis in apple cider vinegar. Can you imagine what that feels like?
Danny, I have one and I can't. Here's something where I can definitely be empathetic. And no, there is, I mean, come on. I mean, guys, really?
I mean, they'll do anything. Anything. Oh, my God. Okay, Lori said one more thing. Lori, I'm so grateful you're on here because normally people are asking lots of questions. I think
Mhm.
everybody's like flabbergasted on what we're talking about. Interstitial cystitis. Sister
Mhm.
suffers greatly from this. Do
Mhm.
you manage IC for women?
Mhm.
Yep.
Yeah, I definitely do, Danny. And this is, I think, one of those areas in urology where
Oh, he's gone. Okay, so what's interstitial cystitis, right? This is inflammation. Anything that ends in itis is inflammation, right? So this is inflammation of the interstitial area in the vaginal bladder. Okay, here we go. Let's get him back on here. There we go.
I think my phone's on its last bit here, so
Okay,
we'll conclude with
let's
this.
go real quick, and then we got to get into how they can get in touch with you and all that.
Absolutely. So, make a long story short, I see or interstitial cystitis is one of the more poorly understood urologic conditions. A lot of my colleagues are stuck in the olden days with how they manage this. This is something that has to be a multimodal, multifactorial approach because a lot of these women need a lot of help and support in many areas of health. And it's not just simply bladder's inflamed, focus on the bladder. So would be happy to help address any questions in follow up. But yes, that's something a urologist would take care of.
Yes. Yes, we did talk about pellet that well in a roundabout way. You do offer pellet therapy, correct? Hormone
I
pellet.
do. I
Well,
do pellet therapy for both men and women for hormone optimization. I think one of the also key advantages of seeing someone like myself for hormone optimization is I go over all the different options with my patients.
you
And if a
bet.
man wants to be on injections or topical therapy or pellets, I have all available. For women, I tend to find that the pellets, in my opinion, are the best option because it allows you to more dial in women's hormone levels, which can are lower than men, and little tweaks here and there can make big differences. And there's too much variability with the injections and the topicals. So I do
You
take care
bet.
of both men and women with pellets.
Yes, and he would be definitely the man you would want to see because I know he goes individualized on this, and that makes me happy. I know your phone is about to collapse over here. Tell us, how do they get in touch with you? How do they get in touch with you? Which I'm actually going to share here. Tell me this: does insurance pay for a vasectomy? I don't know that answer. Does it most of the time, or is it out of pocket?
Yeah. So most of the time it does, but a lot of these young guys have high deductibles. So here's what I'll say. I've got a great team with Pazona MD. It's not just about me, it's about the great people, and we're about exceptional customer service. So what we do as a service for all of our vasectomy patients is we're going to try and best to our ability estimate your out-of-pocket expense. And for some guys it's zero, and for other guys it's they've got to pay out of their pocket because they haven't hit their deductible. So our team will help figure that out.
Right, exactly. Do they need a referral to see you, or can they pick the phone up and dial 527-4700 and come see you? Because we always
Just
refer. We
mhm.
refer because they're in the office usually when I see them.
Sure.
But
Just pick up the phone and call us. We've got so many ways to get in touch with us. So we've got patients reaching out to us through our Google My Business profile. We have patients call us at the phone number Danny mentioned, 527-4700. You can go to my website, pazonamd.com. That's
yeah,
PAZONAMD.com. And you can request an appointment on there, and one of my assistants will call you after you put in a request online. So there's so many different ways. You don't need a referral. We take almost all major insurances, and we also offer cash services and cash pay options. So I want to be the easy button for urology. When you call our office, you should get a human being on the phone, and if you don't, a human being is going to call you back that same day. And if you
yeah,
don't, message me directly, and I'll make sure we get you taken care of.
you bet. All right, before we head out here, we do have a question here about breast cancer and hormone pellets, and that I think is an individualized answer. Um, Kevin, I do that. That's a topic that you would want to talk to your Dr. Joe or your provider individually. Don't you agree with that?
Yeah, most definitely. Now, that being said, I just saw a recent study that was released, Danny, 9-year follow-up from pellets showing a 33% reduction in breast cancer with hormone optimization.
Yes.
Let me rephrase that. It lowers your risk of breast cancer. It does not
Yes.
raise it. There are so many myths about hormone replacement in women. We could do an hour just on that alone, Danny. So, but
And we should, because
yes,
yes, I know that study and I was thrilled to death, but those aren't the studies that make it on the NBC nightly news.
no, unfortunately not.
Yeah, it's the heart study with testosterone in men and things like that. So,
Mhm.
guys, I appreciate you. Dr. Pazona. I am so grateful that you were here. That went by so fast, and I know that everyone is loving this. They are absolutely. And
Thank
guys,
you, Danny.
to him, you've got the phone. He's going to drink his apple cider vinegar right there instead of, you know, dip it. And
I couldn't
Lord,
resist.
I tell you, he's a nutcase. You need to, in a good way, you need to watch his Instagram. I think he's funny. And his website is incredible. He's got great blogs. He writes a lot like I write, which is very funny. Like your personality goes through. It's
Thank
really
you.
yes, and yes, I agree, Donna. We do need to do it again. And speaking of writing, guys, you guys took Wild and Well #1 on Amazon this weekend on new releases. So the book's coming out November the 9th. If you have not ordered this book, you need to order it because it is a game changer. And I need to send, well, you need to order it, but I need to send you one to put in your waiting room.
That
For
sounds
sure.
great, Danny.
Actually, I need to just go by there and do it. This book is fantastic. It really is. And my goal is to help millions of men and women actually heal their body from the inside out. And I am so, so, so grateful for y'all. It's still #1, which is great. Last time it went #1 in May, it lasted for about 2 hours and then it went down. So you guys are rocking it over here. Next Sunday night, we are continuing our hormone journey, and it's all by accident. I didn't mean to do this. And it's going to be Dr. Rita Marie Lascalzo. She actually is a chiropractor, but she specializes. She created the she's the founder of the Institute of Nutritional Endocrinology. What? Which is fantastic, and she focuses on natural restoration of hormones. So we're going to have her tomorrow night. I mean, next Sunday night on Sunday night service, and get in the supplement store and see Britt. Those of you that love Britt, my supplement store manager, this is her last week. She's moving to Utah. The heck? But anyway, I am devastated because you know when you lose a good person, right? Oh yeah, it's devastating. So anyway, get in and see her. And guys, I appreciate you. Dr. Joe, thank you so much. And you guys can share this tomorrow off of YouTube. It'll be up on YouTube. You can take notes on everything that you missed and have your husband watch this. Let them know that this is a great thing to know a male not necessarily a male urologist, but I think a male urologist with male patients is a great place to go. So, all right, guys, appreciate you. Thank you so much, Dr. Joe.
Thank you, Danny. Really appreciate the opportunity.
Have a good rest of the weekend. What hours we have left here, right?
Yeah. Have a great night.
You too.